Okay, thank you very much. I just want to say that I haven't got a crystal ball, so I'm not going to paint you a picture of what services are going to look like. That's what we collectively need to work towards as we move forward. I'm just going to talk a little bit around the case for change, why we need to be thinking about working differently. So what's the drivers for the work that we're all undertaking at the moment? Okay, the first one, and the key one, which Christian has mentioned already, is the workforce. So we all know, everybody in this room works in paediatric services, in children's services, we all know how stretched the workforce is. We've had the workforce scoping undertaken by Kendall Block in association with Health Education England, and some of Kendall Block colleagues are here today. And those who were at the last assembly will remember that Matthew Block spoke at that and told us all what we mostly already knew, that actually it's very shaky at the moment. We have not got enough medics, paediatricians, clinical workforce coming through to sustain the way that we're working at the moment in terms of the services that we're trying to provide. There are rota gaps left, right and centre. I know, a number of trusts have got some significant gaps in consultant paediatrician posts. Nursing staff are stretched and covering, not to mention your AHPs and everybody else that contributes to the workforce. So that is our key driver. So we need to start looking at the workforce. Some of what you're going to hear about the rest of today is giving some examples of what that might look like. So we've got around physicians associates, APMPs, all sorts of other roles, nursing associates that are coming out now, apprenticeship roles. We need to think differently. We need to think about how and where we're providing care. So Ailsa Cormack from Blackburn, a GP in Blackburn, has come to speak later about some of the work they're doing in that area, about joining up primary and secondary care, moving what doesn't need to be in hospital out and doing some work in multi-professional teams. I've put there multidisciplinary working. There are multiple roles out there that we can use in different ways. I know many trusts now are utilising their pharmacists very differently in terms of what they can offer onto the ward, associate roles, all sorts of opportunities. Estate limitations. Some of the trusts are very, very landlocked. The estate is very varied if you look across Lancashire and South Cumbria, from some places that have had some relatively recent developments and estate investment to other areas where actually they've not really had much investment at all. So if we're looking differently, we need to think about the work environment. There's a lot of studies out there that say that the actual environment that you work in has a massive impact in terms of your motivation and your how proactive you are at work. If you're in a nice, bright, lively environment, you're more likely to get that over to your patients. Your patients feel different about being in that environment as well. Hopefully, if you think this environment is nice for a study day. But it does make a difference, the environment that you're in. So estates considerations are key. Digital solutions, we're going to come on to that this afternoon. Multiple opportunities out there that we're not harnessing at the moment in terms of how we could work differently. We need to think, and again, I'll be standing here later this afternoon talking about this, but we are in a unique situation really in terms of being children's services. Most of our customers are what you would call digital natives. So you have two lots of people in the world. You have a digital native and you have a digital migrant. Most people in the room, without hopefully not offending anybody, most of us in the room are digital migrants. We didn't grow up with an iPad or an iPhone. We probably had to press buttons on the television rather than a remote for some people. However, our customers are digital natives. You can see any toddler, they can probably still already use an iPhone by the time they're 18 months. They grow up with it, they're using it, and they expect us to be using it too. So we need to move forward in all sorts of ways around a digital solution. Other drivers for change are national recommendations, national reports that are coming out. One of the particular ones that we're looking at, we're not going to dwell on it today, is around paediatric HDU, so high dependency care. The National Report for Paediatric HDU and Paediatric Surgery is pushing us in the direction to say we need to have fewer, larger HDU facilities in Lancashire and South Cumbria. At the moment, we have a spattering of beds in every provider. That won't be the model in the future. We will have fewer, larger HDU facilities with potentially dedicated workforce with them. So we need to consider that. That's obviously got massive implications for estates, because at the moment, nobody's got an estate fit for having a 10, 12-bedded HDU in it. Neonatology, again, National Review of Neonatology is currently out for consultation. Again, looking at what we consider to be the right size for a neonatal service. Both our level 3 neonatal services in Lancashire and South Cumbria are considered small, if you look at the population and the numbers of cot days going through them. Again, implications for paediatric workforce. If you're not able to offer 2 paediatricians on call within a small service, you are not able in the future to provide HDU level neonatology. You need to be in a position where you can offer a support to a medically unwell child in ED at the same time as a deteriorating neonate. Again, massive implications for what we've got in the area at the moment. So what I'm asking of you today really is to, as we're having the discussions, as you're listening to people, is to sort of open up a bit, dream a bit. Disney had the Disney dreaming tree. I don't know if people, Walt Disney used to go and play at a tree that she called his dreaming tree. And that's where he came up with lots and lots of his ideas about that then took forward into his films, etc. And daydreaming, although I know people haven't got time for daydreaming in a day job, but there is something about daydreaming, letting yourself think differently. It's good for relaxation, it's good for conflict management, it increases productivity, but especially, I don't know what's happened to my formatting here, just to read that, it's increased creativity and goal achievement. Allow ourselves to think differently, and that's what I'm asking you to do today. So coming out of your boxes in terms of, I'm a doctor, I'm a nurse, I'm a this, I'm a that, this is how we do it, we've always done it this way. We cannot continue to do it as we've always done it. So we need to open up, think differently, be creative, look at the different models that might be out there. They might seem completely ridiculous, but there might be a way of doing it. Doing some work with people at the moment around, potentially looking at a shared rota across Lancashire and South Cumbria about paediatric diabetes. And what I've asked people to do is list me all the reasons why they think that can't happen. And then we'll pick them off one by one until it happens. Because most of the reasons people think these things can't happen are myths. We've already now got an MOU signed off across all the acute providers by the HR directors to say that workforce can work across sites. We don't need to do honorary contracts for everything. So we need to think differently. We need to support each other, and that way we will be successful as a system. And the children and young people of Lancashire and South Cumbria will get a good deal for healthcare and will improve their outcomes. So please be creative today. Network, talk to people, and see what we can come up with to do the right thing. And just finally, I presented myself and Christian did last week to the ICS executive team to really ramp up the agenda in their eyes around paediatric services and where we are. And this is what it feels like, and this is what I'm hearing from people that it feels like, that at the moment, paediatrics, women and children's really, not just paediatrics, are a bit like a house of cards. So you are standing up there, you are still in one piece, just about, but just remove one of those cards or have one puff of wind and we'll end up down there. Okay, so you are very fragile as a service in terms of how robust you are, and we need to strengthen that and make that house built of something a bit more solid. If we support each other, we can do that. Any questions? Any comments? Anybody want to disagree?